Buongiorno, everyone. We are on day 8 of our self-imposed isolation in Rhode Island, but still not dealing with anything similar to what is going on in Italy right now. One thing I did want to mention about the whole scenario is just how quickly the whole thing has evolved. In fact, the first important date in Italy's battle with coronavirus is actually January 31st. I was still in Italy at that time, teaching a course for Boston College. And that was the day upon which the Italians suspended all of their flights to China. And I still remember the ensuing controversy about this, but the irony, of course, being that the Italians were the first to cut off flights to China, but the first to be infected on a mass scale by the very disease that motivated them to do so. February 20th was the date where that man who'd entered into a hospital after previously leaving without symptoms, but then being tested positive for the coronavirus, and at that point everyone realized just how the disease had spread widely. March 4th was the date upon which the schools and universities were closed, and at that point there were 3,000 cases nationwide of coronavirus in Italy. 4 days later, March 8th, several northern provinces were put under lockdown. Number of national cases, 7,375. 1 day later, the lockdown was extended to the entire country. And at this point, they were dealing with 9,000 cases of coronavirus. March 11th, so this isn't that long ago at all. All restaurants and bars were closed. National cases were 12,000. And then finally on March 22nd, so 2 days ago, factories were closed, and so too were all non-essential production, technically, halted, and the total number of cases nationwide was 59,138. The point being that all of this has happened over a very short period of time, and from one day to the next, you're seeing how drastic changes can actually be. And in fact, there's a very poignant quote made by the Undersecretary of the Ministry of Health that in the past, Italy looked at the example of China, not as a practical warning, but as a science fiction movie that had nothing to do with us, to do with the Italians. And when the virus exploded, Europe looked at us, looked at Italy, the same way we had looked at China. And so the idea that it's always someone else's problem until, of course, you find it at your front door. Now, many of you have noted the similarities between what the world is going through right now and the Great Black Death of 1348. And if you don't know, I actually produce a podcast series called Rebuilding the Renaissance, and episodes 33 and 34 were in fact dedicated to this subject of the Black Death. And I thought immediately, of course, of these similarities, but thought it was a bit morbid to actually linger upon them in these videos. But I did want to make mention of a very important piece of literature called the Decameron. Written in the middle of the 14th century by a Florentine author named Giovanni Boccaccio, who actually lived through the Black Death. He was an eyewitness to the whole epidemic, and the commentary that he makes about what the world went through are strikingly similar to what we're going through right now. And I just wanted to read you a couple of passages from Boccaccio's description of the Black Death and how people of the time actually interpreted it, because I think you will find again the similarities quite striking. Boccaccio writes, "But whatever its cause, it had originated some years earlier in the East, where it had claimed countless lives before it unhappily spread westward, growing in strength as it swept relentlessly on from one place to the next. In the face of its onrush, all the wisdom and ingenuity of man were unavailing. Against these maladies, it seemed that all the advice of physicians and all the power of medicine were profitless and unavailing." Now, of course, the Black Death had a mortality rate of about 99.99%. But what's interesting to see is how this sort of pandemic played itself out, and more importantly, how society actually reacted to it. In fact, Boccaccio wrote that some people were of the opinion that a sober and abstemious mode of living considerably reduced the risk of infection. They therefore formed themselves into groups and lived in isolation from everyone else. They refrained from speaking to outsiders, refused to receive news of the dead or the sick, and entertained themselves with music or whatever other amusements they were able to devise. Today you watch Netflix. Others took the opposite view and maintained that an infallible way of warding off the appalling evil was to drink heavily, enjoy life to the full, go around singing and merrymaking, gratify all of one's cravings whenever the opportunity offered, and shrug the whole thing off as one enormous joke. It sounds a lot like those kids on the beaches of Florida. Others instead of incarcerating themselves, these people moved about freely, holding in their hands a posy of flowers. Remember the rhyme, pocket full of posies, or fragrant herbs, or one of a wide range of spices, which they applied at frequent intervals to their nostrils, thinking it an excellent idea to fortify the brain with smells of that particular sort, for the stench of dead bodies, sickness, and medicines seemed to fill and pollute the whole of the atmosphere. And these are these people putting hand sanitizer on and admiring cherry blossoms in Washington, D.C. And lastly, and I think for me this is perhaps the most poignant of all of Boccaccio's passages, what more remains to be said except that the cruelty of heaven, and possibly in some measure also that of man, was so immense and so devastating that between March and July of the year in question, 1348, what with the fury of the pestilence and the fact that so many of the sick were inadequately cared for or abandoned in their hour of need because the healthy were too terrified to approach them, it is reliably thought that over 100,000 human lives were extinguished within the walls of the city of Florence. And so this inactivity, this inability to help those who were sick, inevitably causing so many of them to die. And it rings a kind of familiar bell to what's happening. Now, not to leave you on a rather somber note, there is some good news coming out of Italy. In fact, for the third consecutive day, today, Tuesday, March 24th, the number of positive cases or new cases has actually been reduced. And for 2 consecutive days, the number of the deceased diminished as well, although today it's back up to what it was. But being a true superstitious Italian, I don't like to linger on these positive facts because I think that I may in some way jinx them. But keep your fingers crossed that this trend continues, and keep your fingers crossed, of course, that we're learning lessons here in the United States as well. So stay safe, stay healthy, and stay smart.